Some of the other practices we do in life force yoga, whether it's an IFS session or a regular psychotherapy session, some of those practices can go directly to meeting the person where they're breathing in the upper chest and then allowing it slowly to deepen without telling them essentially that they can't do something because they're not able to breathe to the bottom of the lung yet. They probably will be able to develop that capacity, but it's with Life Force Yoga we do it a little bit more slowly. So in most yoga settings, and many therapists have now been trained in yoga, the first breath is yogic 3-part breath. Breathe to the bottom of the lungs, midsection, all the way up to the clavicles, and people can't do it. And so even yoga teachers, when we train them, we suggest that they start with something else called stair-step breath. And it's safe in a clinical setting. It's a really good way to meet that upper chest breathing, and it can also work. It works with both depression. There are two sides of it, and it works with both depression and anxiety. But the only thing I would say is really important that if you're sitting with your client, that you keep your eyes open, because you want to be able to watch their chest and see, and you don't want to be taking steps and they're already to their capacity. Or you know, suggesting that they see something beautiful and they're straining to release the breath. So you need to be able to watch your...
Well, you can say a little bit more about that, because it's not just that, right? I mean, we're talking about dissociation and stuff like that. You as a clinician, I don't want my eyes closed when we're doing something.
Yeah,
right?
Exactly. You don't want your client to be sitting there, you know, like she's getting her bliss. What about me? You know.